Hmm?
Saturday, 7:34 p.m. Goodbye. Thursday, 5:08 p.m. Goodbye.
நீங்க ஆடியோ செக் பண்ணனும் செக் பண்ணிக்கோங்க. நான் லெட் மீ
செக் கேக்குதா?
கேக்குது, எனக்கு கேக்குது.
This is clear and good, right? Lighting.
கேக்குதா?
கேக்குது.
Good evening, everybody.
Good evening.
Oh wait, there's a CN key here.
யூனிஃபார்ம்ல இருக்கீங்களா?
அரவிந்த், ஜஸ்ட் இன் கேஸ் ஆடியோ கம்மியா இருந்தா நான் வேணா இது ஹெட்போன் போட்டு பேசட்டுமா?
whatever உங்களுக்கு எது கன்வீனியன்ட்டா இருக்கும்.
ஓகே.
நீங்க ஹெட்போன் போட்டா ரொம்ப நல்லா இருக்கும். ஏன்னா உங்களுக்கு மத்த எந்த டிஸ்ட்ராக்ஷன் இல்லாம கரெக்ட்டா உங்களுக்கு வந்து கேட்கும் உங்களுக்கு வந்து.
ஹெட்போன் போட்டுக்கவா இது? ஓகேயா?
சூப்பர்.
Watch from my screen on the
We're helping out the game.
இப்ப நான் பேசுறது உங்களுக்கு கிளியரா கேக்குதா?
எனக்கு கேக்குது. க்ளீனா இருக்கு.
இப்ப சவுண்டும் நல்ல கூட இருக்கு இல்லையா?
ஓகே.
ஓகே. குட்.
ஒரு நிமிஷம் டிசைன் பண்ண எல்லாரும்.
அரவிந்த் இது எப்படி இருக்கு இப்ப நான் பேசுறது?
எனக்கு கிளீனா கேக்குறது பிரச்சனை இல்ல.
கிளீனா இருக்கு, கிளியரா இருக்கு இது.
இது கிளியரா இருக்கா இப்ப நான் பேசுனது?
ஆமா.
ஓகே.
Uniform, very red, right?
They want
யூடியூப் லைவ் செக் பண்ண கரெக்டா வந்துட்டு தான் இருக்கு.
கரெக்டா இருக்குது பார்த்தேன் நானு.
இப்ப நான் ஜஸ்ட் ஒரு ஸ்கிரீன் ஷேர் பண்றேன், உங்களுக்கு கரெக்டா இருக்கான்னு பாருங்க.
சுப்பு நீங்க செக் பண்ணுங்க, நான் ஃபேஸ்புக் திருப்பி போஸ்ட் பண்ணிட்டு இருக்கேன்.
எஸ்.
கிளீனா இருக்கு.
கிளியரா இருக்கா?
ஆமா.
ஓகே, குட் குட்.
இவ்வளவு பேர் இருக்காங்கன்னு check
இல்ல ஒரு தடவை அந்த பிரசன்டேஷன் போட்டுருங்களேன். இது வந்து யூ வில் எனிவேஸ் பிரசன்ட் இல்லையா? this yeah.
இப்ப கிளியரா இருக்கா?
கிளியரா இருக்கு.
ஓகே, தேங்க் யூ.
மக்கள் வர ஆரம்பிக்கிறாங்க. தட்ஸ் குட்.
வெயிட்டிங் ரூம் பாருங்களேன். வெயிட்டிங் ரூம்
இல்ல,
ஆப்ஷன் கூட எடுத்துட்டுங்களேன்.
எப்படி எடுக்கிறதுன்னு தான் பார்த்துட்டு இருக்கேன். Admit.
Where's the bed key?
டிசேபிள் ஆயிருக்கு வெயிட்டிங் ரூம். பட் நான் ஒருத்தரையும் அட்மிட் பண்ணிட்டு இருக்கேன்.
அரவிந்த், இன்னொரு ப்ரோக்ராம் முடியும்போது சப்போஸ் யாராவது இந்த ஸ்லைட்ஸ் வேணும்னு சொன்னாங்கன்னா நீங்க யூ குட் டெல் தட் இல்லையா? அந்த உங்களுக்கு இமெயில் அனுப்பிச்சோன்னா யூ கேன் சென்ட் இட். அந்த ஸ்லைட்ஸ்
அது பிடிஎஃப் மாத்தி அனுப்பிச்சிடலாம்.
ஓகே, அத ஜஸ்ட் அது ஒரு இன்கேஸ் யாராவது வேணும்னா. ஆமா, வேணா உங்களை அந்த அந்த இதுல காண்டாக்ட் பண்ண சொல்லிட்டு டிசிஏஎன்சி ரெக்வெஸ்ட் பண்ண சொன்னா அவங்க லெட் தம் கெட் இட்.
அரவிந்த், வெயிட்டிங் ரூம் ஆப்ஷன் எடுத்து விட்டீங்களா?
என்னால எடுக்க முடியல, எப்படி எடுக்கிறதுன்னு தெரியல எனக்கு.
எல்லாத்தையும் கேட்டுட்டே இருக்கு.
நான் பண்ணிட்டு இருக்கேன், கூட விடுங்க.
ஓகே,
நான் ஒண்ணும் பண்ண போறது இல்லையா?
I'm also helping Arvind. நான் பார்த்தேன், just admit, no problem.
ஏன்னா நீங்க ரெண்டு பேரும் தான் பேச போறீங்க. சோ நான் வந்து I'm just going to watch. அவ்வளவுதான். I'll keep an eye on that.
Okay.
இது ரெக்கார்ட் பண்றீங்களா?
ஆமா, Zoomல ரெக்கார்ட் பண்றேன். ஆமா, ரைட்.
Zoomல ரெக்கார்ட் பண்றீங்க. ஓகே, ஓகே, தேங்க் யூ.
The parkour, here's the red key, then you go through.
10 பேர் இருக்காங்க. ஓகே. We'll give a couple of more minutes and then we'll start. TC advertisement போட்டுருக்காங்க. நம்ம கரெக்டா 6:05 ஆரம்பிச்சிடலாம். We'll give a couple more minutes and then we'll start with 6:05.
Okay.
Sure.
சரி, I think 6-5 at ஆரம்பிச்சிடலாமா நம்ம? Shall we start?
Yeah.
Okay. You can go ahead, sir. நான் வந்து எல்லாரையும் admit பண்ணிட்டு இருக்கேன். Okay.
Good evening, everyone. On behalf of TCA, I would like to welcome you all. Today we have with us Dr. Karthikeyan Subramanian. Dr. Karthik earned his Doctor of Physical Therapy degree and certification in rehab administration from University of Montana. He has more than 20 years of experience providing home health, outpatient, and inpatient rehabilitative services for adults and geriatric patients. He is going to be highlighting some preventive and treatment options that are effective and efficient in managing the most common musculoskeletal problems. Welcome, Dr. Karthik. It's a pleasure to have you join with us this evening.
Thank you, Sarayu, for your introduction. Good evening, friends. And I'm so happy to see so many people have joined in this discussion. I also thank Tamil Cultural Association of North Carolina for this initiative. And today, the primary intention of this program is to discuss. When I say like physio to anybody, they ask question, what can I do for my neck pain? What can I do for my back pain? So these are the most common questions friends or people will ask me. So that's why like this topic we have chosen to just to educate and just to discuss more about this common causes of neck and back pain, and what are the treatment options we have, and what are the prevention strategies we can use. So that's the primary purpose of this event. So let's go into some basic information about this neck and back pain. Shall we start?
Yes, we can go ahead.
Thank you. So I hope you all could see my PowerPoint presentation.
Yes, we can see.
Okay. So the primary discussion objectives of this program is what are the common causes of neck and back pain, and what are the treatment options, and what are the prevention strategies. So if you see in this picture, this is how our spine looks like. The very first picture on the left is the view from the back, and the second one is the view from the side, and this third picture is the view from the front. So the first 7 bones on the top is the neck region, and the second 12 is our upper back and mid back, and the lower 5 is our low back. And when we see on the right side picture, we have just focused on few segments of this vertebral column. So here you can see a couple of structures. The first one, what I'm pointing is the vertebral bone itself. So this is how the vertebral body of the vertebral bone looks like. And the next one, what I'm pointing now, is the most important structure in the vertebral column, that is the disc, intervertebral disc. And if you see here, an yellow colored structure, a bright yellow structure, which is coming out of this hole, we call it as a foramen. And this yellow structure is a nerve, which is coming out, and the base part is called the nerve root. So I'm not going to go in detail of this anatomy, but just to have an idea how our spine looks like. And if you see the top 2 discs, they are healthy, they are good, and there is no issues with that. Whereas if you see this third disc, the disc has bulged outside. So when the disc gets bulged due to any reason, and it compresses the nerve. It gives the pressure on the nerve. So that is when we get this nerve related pain in the neck or the back. So that's just for our understanding. Now let's go into the common causes of this neck pain. The common causes of neck pain, the first one, the most common cause is the myofascial pain. So it is the inflammation of the muscle and the fascia, which is underlying the skin and between the muscle and the skin area. So when there is some inflammation or irritation in this structure, that causes some sensitive points in that area, which happens in primarily large group of muscles. And in the sensitive areas, they are called as the trigger points. So some people say like, I have the neck pain on in between my shoulder and my neck, but when I put some pressure in that area, the pain is referred to all of my neck coming down the back. So that kind of sensitive point is called as a trigger point, and that is called the myofascial pain. And the next one we all know is the arthritis, which is the wear and tear of the joint. And the next one is the discogenic problem, like all disc related problems. There is bulging of the disc, there is herniation of the disc, there is sequestration of the disc. So there are a lot of various stages of the disc problems. Basically what happening here is the disc which I have shown you is coming out of its place and then coming and giving some compression on the nerves and on the nerve roots. So that's all problems related to the disc is coming under the discogenic problem. The next one is called as the bone spurs. So the bone spurs are like on the edges of the bones. If let me go back to this picture again. So on the edges of these bones, like here, there may be some small growth of the bony structures, which is again because of the wear and tear or due to arthritis, the bone develops itself or making an adaptation by itself to compensate for that. So that is called as the bone spurs. And in long-standing people with long-standing arthritis, when we look at the X-rays, we could see this bone spurs. And the next thing, next common cause is tumors or cancer in the neck area. Now, we are going into an interesting cause. This is called as a repetitive motion. This is one of another common cause which we could see. Some people, either it may be related to the work or it is related to their habitual activities. They do this repetitive motion. Most of the time people like they sleep in a certain positions, or not only just sleeping, even they do certain activities with the neck tilted position, or they do the nature of the job itself, what they are doing demands some repetitive motion of the neck, which causes this muscle pain or the neck pain. And the next one, what we are seeing is called as a torticollis. The torticollis is otherwise called as a wry neck. We can see in children or in adults also. Basically, the neck is twisted at an angle, and that causes the head to rotate and tilt at an angle. So that is because of imbalance in the muscular forces. In children, why it's happening, the most common cause is because the way they are in the fetus, that the position in which they are lying in the fetus. For adults, it could be even a prolonged poor posture, or the way they sleep could cause this torticollis or the wry neck. The next cause is trauma or the whiplash. Trauma, like any neck injuries, it could be related to motor vehicle accidents, or it could be related to a fall, or it could be related to a blow in the head, any trauma. And then whiplash, we all know that it is a forceful movement of the forward and the backward movement of the neck and the spine, which happens in a whiplash. Most commonly, like it happens in a rear end collision, could cause this whiplash kind of injury. And the next interesting one is fibromyalgia. This is one condition which is very difficult to diagnose because it's like it's a long-standing problem, And this is characterized by widespread musculoskeletal pain, mostly accompanied by fatigue, and there may be the person may be more sleepy, and also that it may affect the memory, and also it cause mood disorders. So all these things are some symptoms of this fibromyalgia. The next one is the meningitis. Meningitis is the inflammation of the coverings of the brain and the spinal cord. And primarily this meningitis causes stiffness, more stiffness in the neck. And its most common cause, it could be either bacterial or fungal infection is the reason. And there are vaccination available for this meningitis. Next one is the emotional stress, like with the COVID situation going around, most people work from home, and that is causing this emotional stress, or it may be related to their finance situation, their job situation, whatever it may be. So all these causes could lead to neck pain. The last one is brachial plexus injury. So the brachial plexus is a network of nerves which is coming out of the neck and coming down to the arms, and it goes all the way to the hands. So whenever there is some injury to this brachial plexus, that could cause pain when the nerves get overstretched, or sometimes in serious cases, even the nerves may be ripped off, so or torn away. So all these things could cause this brachial plexus injury. These are the most common causes of neck pain. When we go to the common causes of back pain, the most common cause is unspecified back pain. That is really, the cause is really unknown, but a huge amount is spent in the medical field for treating this unspecified back pain. Report says almost $86 million is spent an year for towards this unspecified back pain. The next one is sprain and strain. So we all know that muscle strain and ligament sprain could happen. So when it happens in the paraspinal muscles or in the neck muscles, that could cause this back pain. And if there is a strain in the ligament, that could also cause this back pain problems. And again, arthritis and discogenic problems, we already spoke in the neck pain. The next one is spondylolisthesis. So here, the spondylolisthesis is one vertebrae is on top of the other vertebrae. If we, let me go back to this picture. So if you see like here, one vertebrae is top of the other one. What happens here is that the top vertebrae slips forward. It comes out a little bit forward. So the forward slipping of the vertebral bone is called as the spondylolisthesis. And that's again going to compress the spinal cord or the nerves, depending on which segment it is affected. Spinal stenosis. Stenosis means narrowing. I showed you a picture where the nerves are coming out of the small hole. When there is a narrowing of that canal, there are multiple canals in the entire vertebral column, multiple openings and multiple foramens. And when there is some narrowing of that, that causes a spinal stenosis. Next, sacroiliitis. Sacroiliitis is the bone which is at the base of the vertebral column, and where the spine connects with the pelvic bone. And if there is some inflammation of the joint of this sacroiliac, we call it as a sacroiliac joint, and that is called as a sacroiliitis. Most people, when they have the pain, particularly in their buttock region or in their thigh, the common cause is sacroiliitis. It could be associated with other causes also. And particularly when a person is stepping down off of a platform or a curb, and then they experience this pain in the buttock region. So that is one common symptom of this sacroiliitis. Next is malignancy. Um, we all know about the tumors and cancers affecting the vertebral area, which could cause the pain. Next one is scoliosis. Scoliosis is alteration in the curvature of the spine. I showed you the picture of the entire vertebral column. Suppose there is a lateral or there is a sideways deviation of the curvature of the spine, that is called as a scoliosis. So if you see in this picture, the vertebral column is in a straight line when we look from behind. But just in case if this curvature comes out like this and then goes back in like this, that's called as the scoliosis or the sideways curvature of the spine. And also ankylosing spondylitis. That is also another inflammatory condition of the spine and the joints primarily. And where mostly like it results in limited movement, or the flexibility will be affected in this condition. And people who have this hunched back posture, they could have a possibility that we need to check with them with the proper diagnostic procedures to make sure they don't have this ankylosing spondylitis. Next is fractures. Because of any trauma or any injury, there could be fractures and which could cause neck or back pain. Then kidney problems, renal problems, people with any kidney stones, sometimes even any other problem in the kidney functions itself could also refer to the back, causing the back pain. And the last one is gynecological problems. This is a whole lot of issues can relate to the gynecological problems. Either it may be due to post-menopause, or because of this menopause when there is estrogen deficiency or endometriosis. So many conditions could cause the gynecological related back pain. And we all know that after a delivery of a child, there will be laxity of the ligaments that could eventually cause imbalance in the distribution of the weight, imbalance in the distribution of the forces, which is going down through the vertebral column, and that could in turn affect this back and causing some back problems. Also, sometimes people who have the spinal anesthesia also sometimes experience this back pain after the spinal anesthesia. So these are the most common causes of this back pain. Now, let me go to the next slide. Here we are seeing this vertebral body, the disc, and here you can see this is what we are calling it as a disc prolapse. So you could see the disc is bulging out and pushing on the spinal column or the spinal cord, and also on this side it is pushing the nerves also. So that is the disc prolapse. And you see, this is a healthy disc. There is an outer structure called as annulus fibrosus, and this inner structure is called as nucleus pulposus. So what happens here, when there is a degeneration, slowly this nucleus pulposus is coming out. It's like a jelly-like structure. And what happens here, it comes out to the edge, almost to the edge, and this stage is called as the prolapse. And here you could see the gel is totally coming out and causing this extrusion. And here it's totally out and it's like coming out of the vertebral column. So that's called as the sequestration. So these are the various stages of disc herniation. So let's relax a little bit. I saw this meme in the Facebook recently, so I just thought of sharing it. And the way the meme creators are doing it, no offense to any Vijay fans. Vijay fans just a meme which I enjoyed. And so I just want to show it to you. So what we have to do for it, if there is a long-standing neck pain, stretch it, mama. So that's what we have to do it. So let's go a little bit more. Now, since our intention is to make people understand what are all the causes of this neck and back pain, here I'm going to give a small tip or like kind of information. The kind of pain what we have is relating to some structures. So if you have like a pain which is cramping, dull, aching, like people say it's like tightening pain, that is mostly related to muscle, and mostly it will be aching sensation. If it is a dull aching sensation, then it is mostly related to ligament or joint capsule. A capsule is the one structure which covers the joint. So that could also cause this dull aching pain. Sometimes we have some sharp shooting or burning pain. It may come down through your arms or come down through your legs, and that is related to the nerve or nerve root pain. Some people even feel like pins and needles sensation when there is nerve related pain. If the pain is deep and nagging and dull, that is related to the bone. When the pain is very sharp, severe, intolerable, then it is related to fracture. When the pain is throbbing is otherwise like kind of pulsating kind of pain, because sometimes people with vascular problems, for example, if they have abdominal aorta aneurysm, uh, that could also cause this kind of pain, which could refer to the back also. But any pain, any of these kind of pain, throbbing and diffuse pain, is related from the vascular or the blood vessels. There is some circulation related problems. So that's the vascular problem. So this is just to give you an idea. When you have this difference, you have to differentiate the pain. When you go to a therapist or to a doctor, you need to make sure that the kind of pain what you are experiencing, you need to make note of it and tell to the therapist or the doctor. So next we come to the most important part. What are the risk factors for this pain? The first and foremost is the poor posture. What is the poor posture? We all know that, like the way we need to sit down straight. That is, our shoulders should be in level, our ears should be in level, and the head should not be tilted down. It should be straight. So it's not only in sitting, it's when you are sleeping, when you are doing some work, and when you are doing even household activities. So your posture, you have to maintain a good posture. That's the first risk factor here. The second one is previous medical problems. For example, someone had a trauma in the past or an injury in the past. That could also cause, uh, after a long time, that could also cause their pain later in their age. So we need to make sure, like, is there any previous problems which I forgot? When I had a long time ago, I had a fall or I had an accident. So we need to make sure of that. The next is muscle strength. When we do not take care of our posture, that creates an imbalance in the forces of the muscle. We see people sitting like this, forward like this, most of the time, looking into the computer. What happens here? The muscles in the back of the neck will get tighter, whereas the muscles in the front of the neck will get weaker. So that is what we are meaning here as the reduced muscle strength. And also we see people with the core muscles, which is around our abdomen and the back. The core muscles weakness is also another reason why people are getting a lot of back problems. Repetitive motion, as I said, mentioned it earlier, like some people, because of their job or because of their habit, they do that motion repetitively. So that could cause this back pain or neck pain. Intensive occupation. People who are lifting weights every day from certain height and they have to keep it at certain height causes, like, they twist with the weights or lift their weights, carry the weights, or driving for long. So these are some intense occupation which could cause this back and neck pain. Obesity, we all know about it. When people are obese, definitely all the joints in our body is undergoing a huge amount of force is transmitted into the body, into the bones, into the disc, which could cause this neck and back pain. And gender related, as we just saw, the gynecological problems or obstetric problems, so that could cause this back pain issue or neck pain also. Stress and anxiety. With this pandemic situation, there is a lot of stress and anxiety going around, which could also be a risk factor. And people working, even like we take our children, they are sitting in front of the laptop most of the time because of they do their studies, online classes, and everything. So that could cause a lot of stress in them, and there is an anxiety related problem. So all these things could also cause some neck and back pain. The psychosocial factors is equally important as the physical factors when we are talking about this neck and back pain. So now let's go into the treatment option. The treatment option primarily is pain management. The way how when we go to a therapy clinic, there are a lot of modalities we can use to reduce the pain, even starting from a basic thing what we can do it at home with the eyes or heat, the pain management, or we can go for advanced modalities. Then we can go for therapeutic exercises as specific as we understood that all people have neck pain is not because of the same reason. That is the primary reason why we talked about various causes of this back and neck pain. And then mobilization. Mobilization is a treatment where we work with the spinal joints to make the joints move better. We see the vertebral column, but there are total 195 joints in that vertebral column. And we have to make sure every joint is moving what it is supposed to do. So if some joint is not moving, then we have to do that mobilization. Mechanical traction. Mechanical traction is the pulling of the vertebral column, which relieves the pressure from the disc and thereby relieving the pressure from the nerves. And then taping. You might have seen in sports, people are applying the tape on the muscles, which helps the muscles to work in a more efficient manner. And also the muscles which need to relax will be put into relaxation with that. Massage is a very important thing because with people who have a lot of stiffness and people who have a lot of tightness in their muscles, they can get use of this massage. uh, Professionally, like any therapy clinics will have their trained masseuses, like they could also use the massage as a part of the treatment option. Aquatic therapy. People who are long-standing back pain definitely benefit from aquatic therapy, doing the exercises in the water, because when you are in the water, the load of the on the joints will be taken out. Like if you stand at your chest level of water, 70% of your the weight distribution will be offloaded from the vertebral column. And dry needling. Dry needling is a technique in which using a thin filiform needle will be penetrated into the muscle. Thereby, they are touching the trigger points or the sensitive points of the muscle. So thereby reducing the pain sensation which is carried from that particular muscle to the brain. And cognitive functional therapy. As I talked about stress and emotions, there are lots of emotional factors, psychological factors associated with this neck and back pain. So this particular approach helps to work on the habits which need to be encouraged and the habits which need to be discouraged along with the other therapeutic modalities. And we need to practice the relaxation techniques. Like even a basic thing, we don't even breathe right. Most of us, we don't take a deep breathing. We all do a shallow breathing. When we do take a deep breath, I mean, definitely it will help to relax our body. Not only that, we have a lot of other techniques in therapy we can use to improve the relaxation of the muscles. So now what are the things we have? Let me go a little bit faster so that we can give time for questions also. So here, what are the prevention strategies? The first and foremost is practicing a good posture. We all know that the way how we need to work, how we need to do the things, but it is our responsibility to put it in practice. So that's a good posture. And always take a break when you are sitting in front of the computer or at your work. Make sure you take a break, change your posture. Then you have the ergonomics, the way how you are working with. That's very important. Like the how you maintain your posture during your work, any kind of work. So that is the ergonomics, so that you can work more safely, efficiently, and improve the productivity also. So it is the relationship between the movement, what you're doing in a work, and the environment. Then physical activity, lack of physical activity is a major problem which causes this neck and back pain. And nutrition, proper nutrition is very important. Like we need to take calcium, we need to take milk, we need to take some the sources which is rich in calcium, which can help in bone and joint health. Like for example, like we could also use we call it as, in Tamil we call it as perandai. That is like in English, we call it as actually adamant creeper or welt grape. So that could be used because we know that when there is a bone need to be stronger, we can take such kind of things in our diet, like modakatan kirai. Like we can, it's called as balloon wine. We can take those kind of things in our regular diet, which will help for improving our bone and joint health. We can use some tofu and beans. Soya beans have a lot of good things like which can help in our bone and joint health. So like that, we can talk about the nutrition also. That is very important. And avoid smoking. So smoking, what people should know that how when you smoke, what happens is this nicotine is going into your body and then it affects the microcirculation. I showed that disc is a major structure in the vertebral column. It needs circulation, microcirculation. And the nicotine, when it affects this microcirculation, the disc will not get enough nourishment. That is why smoking causes this back pain and neck pain, mostly back pain. So here is a picture where we could see when a person is not sitting right. So we could see that one group of muscle is getting tight. So if you could see this muscle is getting very tight, and the other group of muscle is getting very tight as the pectoralis and your trapezius muscles are getting tight. Whereas the other two group of the opposite group of muscles, which is the deep neck flexors and your rhomboids group and the serratus anterior, or the muscles right up here, is getting weaker. So here you could see when you are sitting in a poor posture, what is the reason? That creates an imbalance in the forces. When there is an imbalance in the forces, definitely it's going to affect the vertebral column and causing nerve related pain and joint related pain in the neck and the back. So here is some ergonomical picture. So you can sit at the desk, how your elbows should be, how your arms should be, how your eye distance should be. Here you could see the neck posture is more straighter, and it's between about anywhere from 10 to a 30-degree angle it is located. And look at the elbows and hip, they are maintained mostly at 90 to 110-degree angle. So that will help. And look at the feet. The feet is kept in a very flat supported position. So that could help for correcting your posture. So make sure you adjust the table height, the monitor height to maintain your lumbar curvature and your upper back support. So I would rather use this ball, gym ball, to sit down. If people who want to really work out during their work, use a gym ball instead of a chair. That will keep your muscles worked out more. That will also help a lot. And here you could see the way how you could organize your uh, desk. So there is the frequently operated zone, less frequent zone, and a rare zone. So make sure what are the things which you need to have, keep it close by. Here you could see how you can organize a standing desk. So that's again to maintain your posture straight, and your elbows should be maintained at 90 to 110 degrees angle. And look at here again, the neck is not bent. It's only the vision is looking at the monitor of the computer or the screen. So this is called as the text neck syndrome. So look at the poor posture here, how the neck is bent. And this is the correct posture to look at the cell phone or using a device to keep it up at a high, at the shoulder level height, so that you can, your neck, you don't need to bend it down. Even not only when you're doing those kind of work, you can even look at this posture here. So when we brush our teeth, this is a better posture, keeping the spine straight, and you can support your one leg under the cabinet. So that'll be good. And then here it's a poor posture. Obviously, you are bending all the neck and the back. When you're vacuuming the house, cleaning the house, the good posture is to stand up straight again, not to bend your back. Washing dishes. So I'm sorry, I put the picture of a person who is washing the dishes. That's good. So again, maintaining the posture is very important here. The way he stood is the same way as the other picture, which showed how to brush with a good posture. Carrying a luggage or a suitcase. So this is a better posture. Evenly distributing the weight on either sides. That's the main thing. So that the weight is not distributed more on one side, causing an imbalance in the muscle work, which eventually causes muscle strain and also a lot of other muscle pain, which could cause the neck and back pain. So the proper way of lifting any object is to squat and lift, not to bend and lift. The way you are sitting and reading, the way you are sitting and looking at your laptop, so you can use this good posture. When you need to lift and turn to other side, instead of twisting the back, turn in steps. So that will also help to improve your work ergonomics. This is one important thing I want to show you, like a sleep position, how you have to sleep. See, look at this. When you are sleeping on your side, make sure there is the space between the neck and the shoulder is filled with pillows, so that the neck is kept straight, and the spine is kept straight. So that's very important, because sometimes we sleep with a thin pillow, bending our neck to one side. So that is a poor posture, but this is a good posture, how you have to sleep, keeping two pillows on your side and keeping a pillow in between your knees to have a good rest, and also keep a pillow under your arms. So this is a good, comfortable, relaxing, good posture for side sleepers. So whereas if you want to sleep on your back, keep a pillow under your neck, which is thin, which is not too high. So that is a good posture to maintain the spine in a straight line. And then you can keep a small pillow under your knees, which will help to relax the knees and also help to relax your back muscles also. So the back will become more flat when you lie down with a pillow under your knees. So these are some stretching exercises, which we can show it later in the session if needed. And before that, now we'll take a break here and give some time for question and answers, so that if you have any questions, please ask, and I'll pass it on to Sarayu. Sari, if you have any questions, or if anybody has questions, please ask.
Yeah, please unmute yourself and ask any
Ask
question.
the question. Or you can even type in the chat. It's fine. Okay, I'll go ahead and I have a question here. So you were talking about the sleeping positions, correct? So do the mattress or the pillow, do they make any impact on the sleeping, or is it okay if you have a soft mattress? Or because when we go to buy a mattress, that is one of the major questions that's being asked. So what kind of a mattress do you think it's preferable, or is it okay that we can buy whatever we want?
Okay, so here we'll talk in two aspects. One is in prevention, other is in treatment. So people who have who do not have back pain just because of their work, they have the tightness in the muscles and they want to sleep right, they want to know how to do. They can use just a firm mattress, not too soft, not too hard. It's just called as a firm mattress. They can use it. On the other side, people who have neck and back problems, depending on their neck pain or back pain, they can go for, and depending on their financial resources also, they could go for adjustable beds. Some beds, like you can see, they can tilt at an angle, or instead of using these pillows, like for example, instead of using these pillows, the bed itself could transform into like it can bend a little bit at an angle, adjusting your leg posture. And also the upper part of the back can be kept flat. That could be used, the other form of beds. People with spinal stenosis, they cannot lie down flat on their back. So they need to be a little bit, the upper body should be tilted when compared to the lower body. So that will help. So primarily, the suggestion is to have a firm mattress for people who want to prevent any back pain or neck pain. And using the pillows while you are sleeping, just a soft pillows should work. Just a soft pillow should work. Some pillows which adapt to the curvature of your neck should be individually prescribed. No one pillow or one kind of mattress we can prescribe to everybody. Particularly, I'm talking about people who have back pain or neck pain. But in general, firm mattress and soft pillow is what we recommend.
Okay, sure. Thank you so much.
You're welcome.
So, does anybody have any other questions?
Yeah, this is Arvind. I have one question. Typically, for somebody who works in computer for a long time, like me, I often find my neck is stressed out a lot. And I mean, what kind of things I can do to relax my neck?
Yes. So here I'm going to show you some stretches for the neck. That's what I was about to talk, and you brought up at the right time. So here in this picture, you could see we are doing a muscle stretch here. This is one. I'm going to show you some few stretching exercises for people who have joint or the muscle stiffness. So when you are standing at a corner of the wall, have one foot in front of the other and then like stretch your arms at the side. So once you stand in this posture, don't move your upper body, just bend your knees forward, which will push your upper body more into the towards the corner of the wall. So this will cause some stretching in the pectoralis muscles, which is in the front side. We are seeing from the back posture, back view, but in the front, the muscles will be stretched. That is one good stretch. When you stretch a muscle, remember, you don't need to do it too many times. Just make sure you do 3 times in the morning. With every stretching position, if you could maintain up to 30 seconds, that would be really helpful. So this is one stretch, pectoralis stretch. The second one, the most easy one, like when you are sitting in working in the computer a lot, make sure you sit up straight and like you can do the stretch like so easy. Have your hands clasped behind your head and then just like a butterfly, like stretch your elbows backward. So you could easily feel a pull in the pectoralis muscle region, and that's one important stretch we can do it. Now, the third stretch, we call it as the upper trapezius stretch. So in this stretch, you see the person is holding one hand on the chair, the other hand he is holding on the top of the head and gently bending the neck on the opposite side. For example, if you have tightness more on, for in this image, the person has more tightness on the right side. Now, here he is gently pulling the neck to the opposite side. So which causes this stretching to this muscle. Always remember when you do the stretching exercise, it need to be slow, gentle in the beginning, and then hold in the position where you can tolerate. Don't cause a pain because of the stretching. Your stretching should cause a sensation of pulling, not hurting. So there is a difference between a pulling and a hurting. So we don't want anybody to get hurt because of the stretching. So pulling sensation is what you need to feel when you do any stretch. Another stretch, very simple stretch, it's called as a scalene stretch. This scalene muscles like is on your side, but it is a little bit deeper inside the side of the neck. So what you can see here, this person first tilt his neck backwards and then rotate it to one side. So that is another stretch which you can use it for the scalene muscle stretch. So these are some of the stretches, and here you could see another muscle stretch where it's called as a levator scapulae stretch. So where you are having neck is bent towards your opposite pocket, so or your opposite armpit. So the neck is bent down, rotated, and your hand is on the back of the head, pushing it gently down. And so this is a levator scapulae stretch. So this is another stretch which you can do every day during your activity when you take some time. And don't do all the stretches at one time. Do the stretch over the period of time. So that will help even to take a break for you during the work. When you are sitting in the chair, you could do an upper back stretch. So you are just sitting in and then having your hands across the shoulders and then tilting yourself backward, and that causes the upper back stretch. So these are some stretches you can work out for preventing the neck stiffness, or even to treat the muscle stiffness which is related to this neck pain. I
So,
hope
can
that
we also use these stretches like, when we get up in the morning, we feel the stiffness. So, you would suggest that we use 1 or 2 stretches in the morning to relieve ourselves too?
yes, definitely. Not only in the morning, if you do some stretching the day before, that will help on the next day. But again, you need to make sure what is your sleep position and the way how you are doing your everyday chores. So that's also equally important along with this stretching. And since you brought a point, is this stretching alone enough? No, it's not enough. We need to stretch the muscles, and also we need to strengthen the muscles. A tight muscle is not a strong muscle. So there should be always a maintenance of balance between stretching and strengthening.
We have another question here. Is contoured pillow good for neck back pain? Any long term implications?
Contoured pillow is good provided it is the person is thoroughly evaluated and recommended for that kind of contour which adjusts to the curvature of the spine, because as you see the neck has a curvature and the neck curvature has to be supported by a pillow. Some people, even if they don't if they see a clinician, they will recommend for a small towel roll to put it under the back of the neck when they are lying down flat on their back. So first, if you want to try a contour pillow, I would recommend you to use this towel rolled up at a like a maybe like about, I'll say, 2 to 4 inches height, and just put it behind your neck and lie down flat on your back. Couple of days, see how it helps. Then you go for the contoured pillow. Of course, as I said before, the contoured pillow I would recommend after evaluating and making sure that will help you for the posture. Then I would recommend for the contoured pillow. Yes, of course, the answer is for some people, it definitely helps.
Thank you. So another question we have here is most of us, we have kids, like you said, they're working from home most of the days now in front of the computer. So is there anything in kids terms, how in general would you like to, tell them or give them a message that this is going to help them? Or because we see them working, just sitting, and the posture for kids, it's not like us to take initiative to learn how to sit and all that. It is difficult to make them understand. So how would you tell us to, convey the message to them, or what are some exercises or some things that we can make them do during the computer time?
Yes, that's a very good question. Like I would recommend the first thing is encourage them to get out of the seat where they are sitting as much as possible, and take them to go for a walk inside the house, or do some jumping like skipping, or you can buy a trampoline and ask them, you can put the trampoline nearby, and when they take a break they can do some plyometrics in the trampoline. And also you can get a gym ball, or the ball which I showed you in the previous picture, the ergonomics picture, and buy them so that they can sit in the ball, keeping, definitely they have to keep their spines straight, working on their core and the paraspinal muscles, so that could also help. And yeah, the most important thing is encourage them to play more. That will help. And also the other thing is, I'll show you one, even you could encourage this particular exercise. When they are sitting down, they can stretch to get it, the upper back stretched backward. And I'll show you another exercise. Let's go here. Yeah, so this exercise is very good. Actually, if the kids love it, ask if kids love exercises, like ask them to lie down on their stomach. And then this, we call it as a prone W. That means the hands and the arms is in a W position. So here you could see the muscles which are going to work is the muscles which is in between the shoulder blades. So the shoulder blades muscle are the ones which is getting weaker when they hunch forward. So these muscles need to be strengthened. So ask them to work like this, have a towel roll placed under their forehead, lying down flat on their back, and then ask them to lift their shoulder, their arm, and their elbow and hands all in same level, and then lift it up and keep it moving up and down, maybe like 20 times every day at least. That will help to improve their posture, to get sit up more straight. So that's one important exercise. If kids are more into the exercise, ask them to do simple push-ups. Push-ups is a very good exercise for correcting your upper back posture. And we can encourage our children to do at least like 20 push-ups every day. That will help them. Push-ups is a very good exercise for children, even for adults also, to improve their posture.
There's one more question in the chat.
Sharp pain in tailbone while sitting for long hours. Any recommendations on exercise?
So the tailbone pain is another important issue. We need to find out what is the reason for the tailbone pain. So is it because of the spinal alignment is like that, or is it because of the coccygeal problems? We call as the tailbone as coccyx. That's what I mean as a coccygeal related problems. So when there is a coccygeal related problems, uh, definitely after a thorough evaluation, we can recommend for them a pillow which is called as a donut pillow, which has a hole in the bottom, but whereas on the side, like the same way like a donut, and you sit on top of a big donut. So that is called as a donut pillow. If there is a coccygeal pain, donut pillow will definitely help for them, for relieving the pressure on the coccyx. That is the home management part of the coccygeal pain. But we need to make sure what is the reason for this coccygeal pain. Recently, one of my friend's wife delivered a big baby, 10-pound weight, and then the mother had a coccygeal fracture after the normal delivery. So we need to find out what is the reason for this coccygeal pain, whether it is a fracture or is it like a poor posture, or is it because of some strain or some injury. But in home remedy is like sitting on a donut pillow will help them.
Hi, I have a question. Can you hear me?
Yes, yes, we
Okay,
could
so
hear you.
I have a shooting pain from my neck. I understood it's because of the nerve injury from your slides, and the shooting pain radiates from my neck to my fingertips. And I have been doing stretches. This happened like 10 days back, and I consulted some doctors, and they had put me on steroids, and I went to physiotherapists. They taught me stretching, and but I don't. The stretching has helped a little bit, but it's been like more than 10 days now. Now I don't know whether I should continue with the stretching or do the strengthening exercise, or I don't think my pain has reduced considerably. Even it's still there.
Okay. So let me ask a couple of questions to understand your pain better. Is the you said it started 10 days ago, and is the pain is in the same intensity, or is it varying day by day, or getting worse day by day? Or is it just staying the same? The first question. And the second question I want to know is where the pain is radiating. Is it coming, you said up to the hands, is it all over the hands, or is it on the top of the hands, or the first two fingers, or the last two finger, or is it in the middle finger? So that's another thing. And the last thing which I want to ask is whether did they plan for a continuous physical therapy evaluation, or it just like one session and then you stop going to therapy session. If you could let me know, if it is okay with you, if you could let me know, I could help you a little bit better with it.
Sure, definitely. So the pain started 10 days back, and I consulted doctor, and he had started me on steroids for a week. So after that, it has reduced. When it started, it was very severe and intense. It has reduced. But I have a very small child, 1 year old. I had to carry her. Whenever I carry her, I get this pain back again. And so it has reduced, but I still keep getting it whenever I do something with my hands, or whenever I'm taking complete rest. It's better. But when I start doing some work with that hand, it goes to the same intensity. So that's the answer for your first question. The second one is it radiates to uh, the upper arm, and it radiates to my index finger and the middle finger, sometimes the thumb finger. It's not with the little finger or the other finger. So, and the third question is I just met the physiotherapist once. I was asked to do so, so I did not meet them again. And I stopped
Okay.
the steroids after 1 week, as per
Okay.
the recommendation.
Okay. Thank you for the information. Actually, like your problem, what I'm thinking is it could be the inflammation of the nerves because of there is some compression happened on the foramen where the nerves come out. And because of that inflammation, that is when you got this shooting pain. So what the steroids did for you is you are reducing the inflammation by taking the steroids. So now the inflammation has come down. So the nerve swelling has come down, and definitely now the nerve is ready to start to move, because the nerve has a little bit movement. It has to slide and glide when it comes out through the small openings. So that could definitely have some need some time for the recovery. This stretch, the purpose of the stretching exercise, what the clinician or the therapist taught you is because the nerves need that gliding and the sliding movement. So make sure that you do the stretching exercise in a correct technique and also the correct number of repetitions. So that's one thing which I would first make sure. The second thing is I would definitely follow up with the therapist, whoever evaluated you, so that they can find out more like what exactly is the problem here. Is it just because of the nerve root irritation is it happening, or is it because of any associated muscle strains have happened along with that? Of course, as you mentioned, like with the 1-year-old baby child you have, when you are picking up, when you are holding, and when you are feeding him. So make sure you maintain the good posture. And I would recommend, if any stretching exercise, if it hurts you, you need to stop and ask the therapist. If it is not hurting you, whereas it is like still the pain is remaining the same, probably they have to use other modalities. Like as I said, there is another modality called as a traction. They could, I'm just what do you say, on a superficial view of evaluation, I'm just telling you some suggestions. Like the traction, a mechanical traction could help some for some people. And then also some different kind of isometric neck exercises will also help. Like for example, but again, for you specifically, you need to follow up with the therapist to make sure you are doing the stretching exercise correctly, and also the number of times you do. I'll show you some exercises. Hopefully, you all can see me. Let me uh, pause my share here. Okay. So if you can see my screen up here, like some exercises, you sit in a good posture and do some neck strengthening, like having the hand on the forehead and give a press on the forehead and hold it for 5 seconds. See, my neck is not moving forward, but I'm giving a little bit gentle pressure forward, and then hold it for 5 seconds and you can relax. The same thing, you can have the hand on the side. Don't bend your neck, don't tilt your neck. Just press with the head on the neck, on the hand, and hold it for 5 seconds and relax. The same thing on the other side. Press it, hold it 1, 2, 3, 4, 5, and relax. And press it with the hand on the back and hold it 1, 2, 3, 4, 5, and relax. So this is an isometric neck exercise which you can use for improving the neck muscle strength. And also, along with that, the other thing is good posture. As I talked about the posture, maintain the good posture. Continue the stretching if it is not hurting you, and follow up with the therapist. Make sure, because on one sitting, on one evaluation, we cannot diagnose exactly how the problem could react to the stretching or to the exercises what we prescribe. So we have to have a follow-up with the therapist. You don't need to go. You can have a virtual session with the therapist. You can have a phone call with the therapist and make sure that you are doing everything correctly. And what additional things that you can do it for the pain. People who have radiating pain like this, when I was working in the outpatient clinic, usually we recommend them to come to the clinic at least twice a week, to at least for 3 to 4 weeks time, to make sure that we are working on the correct pattern, we are following a protocol for that, and go from there. But I do not know about the discussion, what has happened with your therapist. So just I would recommend you to follow up with the therapist.
Thank you so much. Thanks for the detailed reply.
You're welcome.
Lingesh, do you want a question or? Okay, he's got a question. Is it okay to wear back support belts while sitting in chair during work or driving car for extended duration, like the lower back lumbar support belt?
Yes, with the evidence, with the increasing evidence, the effectiveness of the belt is very less evidence that supports that using a belt is helpful for a back pain or a neck pain, like collar for a neck pain and a brace for a back pain. So I would recommend no one that you need to use a belt or a brace unless they have a fracture of the spine. They need to be prescribed a specific kind of brace which supports and protects their spine not to have any movement. But I understood from your condition it's just for like a general back pain. Could I use a belt? I would recommend no brace or belt for any person with back pain. The reason is progressively there is less evidence suggesting that using a brace helps with the pain. To go further into the details, like into for helping you out a little bit, let me try to show you some exercise. Yes. So people who have back pain, like general back pain, they are starting with, here is some exercise. This is called as an abdominal bracing. Like lying down flat on the back, like try to work on your core muscles. That is, you can see the person is pushing his belly button or the navel towards the spine. So not by with his hands, but he's tightening the muscles in the front of the abdomen, and then he is pressing it in towards the spine and holding it for 5 counts. So that will help. This is called as abdominal bracing exercise. You can do 10 times in the morning, 10 in the afternoon, 10 in the evening. But lying down flat, make sure your back is totally supported, and then bracing. This is called as a stabilization exercises. What we are doing here is to stabilize your core muscles and your paraspinal, that is the muscles in the back, to work together to act as a brace. So thereby it helps for your back pain. So this is one exercise. And here you can see this is the normal arch of the spine. So here the person is making it flat and holding it for a couple of seconds and relaxing again. So this is called as a pelvic tilt exercise. So this could help you. And here, that's another one important exercise. We call it as a transverse abdominis activation. This transverse abdominis muscle itself, it's a brace. Imagine there is a brace inside your abdomen. So that is how this transverse abdominis muscle is. So this muscle works when you are lying down in this position, inverted V position, and then lifting the foot off the bed 1 inch or 2 inch and holding it 5 counts. So that will work on your transverse abdominis muscles. So this will help for improving the stabilization of the back and your core, which will help your back, generalized back pain. So these are some things which you can try that could help you.
Thank you, Karthik.
You're welcome.
We have another question here. Many of my friends also complain radiating pain, especially on the right side of the body after long hours. So, any tips?
Okay, so here the question is a radiating pain. The moment
On the right side.
Okay. Okay. So the moment when you say a radiating pain, that is the pain is definitely coming from the nerves. One treatment, one exercise in this particular condition, radiating pain cannot fit everyone. We need to make sure what exactly we need to go individual by individual. Basically, when you are saying only on the right side, that means you have to work on the posture. So let me show you one picture. Okay. So if you see in this picture, this is a different exercise, but for explanatory purpose, I'm going to use this. Please don't do this for your radiating pain. Like what happens here, if you see this person is bending his spine to one side. So what happens here, there is more compression happening on one side, whereas there is stretching happening on the other side. That is what it happens usually when you do any kind of stretching exercise. But for people who have poor posture, it may not be visible, very obvious that the person is having a compression on one side in the spine and elongation on the other side of the spine. So people who have this radiating pain, what happens is there may be a compression going on inside at the nerve root, or it may be at the nerve pathway. We call it, there is a muscle called as piriformis muscle, and this particular muscle is letting a nerve to pass through the muscle. The nerve is called as a sciatic nerve. When there is a compression of that nerve because of the tightness in the piriformis muscle, that could cause some radiating pain, because the nerve is compressed not at its root where it comes from, but it is compressed at a different place, that is a piriformis muscle, which is deep inside from the spine to the, which is connected to the vertebral bone to your hip bone. So we need to find out where exactly the problem is happening. And depending on that, we have to relieve the compression on one side and then make sure the other side, the muscle which is overstretched, need to be strengthened on the other side. So the question, what you have asked is more radiating on the right side. The problem could be from the poor posture, or the problem could be related to the nerve compression because of an isolated incident, or it could be because of the repetitive motion, what you are doing at your work, or it may be any work. So we have to identify exactly what it is happening, and we have to relieve the compression from that side before we do some strengthening exercises.
Bharat, do you want to go ahead?
Yeah, sorry, I wasn't good. Sure. Hi, Karthik, Bharat. I wanted to check. Recently, right, maybe for the past 7 or 8 months. So I used to stand a lot, even in the workplace or when I play or anything, right? I do not feel any radiated pain in my lower back or in the back, right? But recently, after working from home, so certain things got changed. Right? Most of the time, I won't sit in the chair, or I will be sitting on the sofa. So nowadays, even for 1 hour, right? If I stand continuously, there is a lot of pain in my I would say in the back, not on the lower back, but at least on the back. So any reason for that?
Okay, so your primary problem is standing for long increases the pain, if I understood correctly. Is that
Yeah,
right?
correct, Karthik. It was not before, but recently, like 6 months, I would say.
6 months.
Yeah.
Okay, so 6 months is a pretty long time. The pain has become, by this time, it is called as a chronic pain. Any pain more than 3 months is called as a chronic pain. So like again, if you are standing for long and causing the pain, is first we have to look at a joint called as a facet joint. The problem could come from a facet joint depending on which level your back is. What I mean by facet joint, let me show it to you in the very first picture. So see, look at this picture. You have, this is a bone and this is another bone. So in between the bone, this structure, this is called as a facet joint. So we need to make sure this facet joints are moving correctly, because that gives a very little movement. It's a very minor movement, but it need to happen for the spine to move as one whole segment comfortably. So make sure this facet joint is not affected. first. Second thing is whether we need to check whether there is arthritis related problems. There could be some arthritis problems. Even people, when they are like reaching their 40s, they could get some arthritis problems. So it could be related to the arthritis. And the next thing, like what we have, as we discussed, whether it could be related to your core muscle weakness. When there is a core muscle is not toned up properly, when you are standing, you are putting too much pressure, definitely it is distributed in the spine. So we have to make sure like when how your core muscles are engaged during your standing. So that's another thing which we need to look for. So you need to work on the some stabilization exercises, which I already showed in the picture. And you could also try, let me show you this exercise. Okay. So you can also try this exercise. This is called as a single knee to chest stretch. So pulling the knee slowly towards the chest and holding it for 30 seconds and then relax. Try it every day in the morning 3 times, and then you could give a feedback on that. And we can definitely talk about that. I could help you on that. So this is one stretching. You can do it every day. Try it. The other thing is like once you feel better with that, then you do this double knee to chest stretch. You can work on this stretching also. And this is another thing. Yeah, if people with arthritis pain, if it is just arthritis, the rotation from side to side, again in an inverted V position, your back is flat, you are lying down flat, and then moving the knees together to one side to the other side gently. Um, so that also could help you in the morning. When you do this, it will help to work on your the paraspinal muscles to get a little bit stretched and the spaces to be opened up so that the nerves could move more easily. So these are some movements, stretching and rotation movements. Apart from that, you need to work on your stabilization. Like as I previously showed some, the abdominal bracing, the transverse abdominis activation, and pelvic tilt. So those exercise also you can work on and give a try on that. And also make sure that, because there is another reason, there is a factor called as obesity. So we have to make sure what is your height and weight, whether the body mass index is good, at the appropriate level for your age, height, body stature. So that also we need to take into
Yeah.
consideration.
So BMI is a little on the higher range for me. Yeah, that's been
Yeah.
that's been always there. But recently,
Yeah.
yeah.
But as you know that, like, I'll tell you one important information. Like, though, like our body weight is high, like we may be obese for over a period of time. Why this problem happens? After 20 years of age, the muscle starts losing its mass. We call it as a mass, or the bulk of the muscle slowly start to decrease. It loses its strength. It loses like how many fibers inside a muscle is recruited for working. So all these things, like over a period of time, like between 20 to 30 years, the loss is starting. The loss in the muscle mass is starting, and it accelerates in the middle age. Like by the time like you are at 40, between 40 to 50, almost 10% of the muscle mass will be lost. So we have to think in terms that's called as a sarcopenia, which happens with everybody. So that's why regular activity, regular exercise is very important to maintain the muscle mass, at least to slow down the rate of losing the muscle mass. So that will also, we need to take into consideration, like we need to think about the muscle mass also.
Okay,
Doctor,
sure. Thanks.
I have a follow-up question to Bharat. Some of the pain, right? Is it direct? Is it related to any way the way in which we walk, right? How do we land our foot or things like that? I mean, will that cause any impact? Like for example, for people who stand a lot, or people who walk, people who have to move often, right? Is there a way that they have to land on their feet to minimize some of these impact?
Okay, so basically, I understand your question is there a correct pattern of walking?
Yes.
Okay, so actually, you brought a very important point. People who have back pain have difficulty walking on a hard surface. Like if you are walking on in like inside the Walmart or walking on the sidewalk, they'll be feeling their back is hurting. Whereas when they walk on a grassy area, when they walk on like a surface which is not really uh, really like hard, uh, for them, like the pain will be better if they walk on a grassy or kind of rubbery surface rather than a hard surface. So that is one thing, the surface in which you are practicing your walking, that could affect your back pain. One. And the second thing is the kind of shoe what you are using is also very important. We need to look into that. And to answer to the question directly, uh, walking pattern, yes, walk with the straight, erect posture. That is the first thing. Make sure your shoulders are in level and your hips are in level. That is, your pelvic bone should be equal on either sides. Never let the pelvis tilt on one side and walk. So make sure you have the pelvis on like on the same level, but when you walk, it will go up and down, up and down, up and down, or it can tilt forward and backward. The pelvic bone, that is, I'm talking about the bone at the hips. If you can see here, he's tilting his pelvis also here. So that is one thing. And the next thing is when you are walking, the first step, like imagine my hand as the feet. Okay, my hand as a feet. So the first phase of the step should be the heel striking the ground. So this is a ground. Let me show you. So this is the ground. My heel strikes the ground first. Then the foot becomes flat. Then we call it as the toe walking, or the heel raises up and then it goes for more tippy toes pattern and then comes off the floor. So the first part of the walking pattern in concern with your foot is the heel strike, foot flat, and then the heel up, and then the toe up. So this is one part of making sure if you are walking on the right pattern. Some people, what they do is they slap on the floor when they walk instead of this pattern. So make sure the walking pattern is correct. The people, why they are doing this, it may be habitual, but there are a lot of other conditions. There may be a problem with the foot drop, or there may be a problem with the weakness in the foot muscles, or because of the way the arch is set up like that in their foot. Some people have the flat foot, so we need to check on that aspect also, before like telling a um, to modify what they need to modify. But the general pattern is like when you walk, heel strike, foot flat, and then heel up and toe up. So that is the pattern of walking.
Thank you, doctor. I think Nishita has a question in the chat. Nishita, do you want to ask a question?
Thanks, Karthik, for your time and answering the questions.
You're welcome.
Nishika, do you want to ask a question?
So she's asked, what is the common reason for nerve issues that cause radiating pain?
Okay. So the nerve, let me go back to this picture. Okay. So if you see, this is the nerve root in this picture. This is the nerve root, which is coming from the spinal cord. The spinal cord is inside here, and from the spinal cord, the nerve is coming out. So here you could see these two discs are healthy. There is no problem. So the nerve can easily like come out, and when you move your back, when you bend, when you twist, the nerve can easily slide through this hole, through this opening. Whereas if you see in this part here, what happened is the disc is already bulging out. The bulging disc is compressing this particular nerve. Depending on which level of the spinal level, or which level of disc, it may be here, or it may be here, or it may be here. So which level of the disc and compressing the nerve root, depending on that, wherever the nerve is supplying, we call it as a dermatome. That is, one particular area of the skin is supplied by one nerve root. Like if we take this one, like this nerve root can supply to one specific area of the skin. So for example, if you take the hand, like the thumb and the index finger, part of the middle finger is supplied by one nerve root, I'll say. The middle finger is supplied by another nerve root. And these two fingers will be supplied by another nerve root. So depending on which nerve root, whether this one or the top one or the middle one or the lower one, like that whole spinal nerves, where exactly this disc problem is happening, that could cause the pain in the area where the nerve is distributing or providing the sensory input. So that is where the pain happens. That is called as a radiating pain. This is one reason which could cause the radiating pain. And you asked an important question. It made me to explain another point here. I may be having a bulging disc. Many people might have a bulging disc. They won't know it. But when they will come to know is when the radiating pain is happening is when the bulging disc is compressing the nerve, and the nerve has no more room to slide and glide. The nerve gets irritated and the nerve gets inflamed. That is when the nerve gets inflamed, it gets more thicker, or it swells. Like normal size will be swelling a little bit more, adding more difficulty for the nerve to slide and glide. So that is when you have this radiating pain. And also when that is when, like as previously one person has asked, like the radiating pain that they took steroids. The steroids helps like to reduce the inflammation of these nerves, and so that the nerve can slide and glide better. So the radiating pain is because of the compression in the nerve root, and the bulging disc is one reason for that compression of that nerve root. There are other reasons, which I don't want to go in detail into that, but there are other reasons which could also cause this radiating pain.
As a follow-up question, I would like to ask, whether it is a radiating pain or a normal pain. Only when we have the actual pain, we are going to know about it. So like you said, there are some measures that we can take at home, like ice packs or the heat packs. But what time do you think, that we would say, okay, this is the time that we need to visit for a doctor? This is not like a home treatment. Because right now, the situation, a lot of people are hesitant to go to doctors, or they don't know if it's an actual pain or if it's something that will go away in 1 or 2 days, or if it's just for a small amount of time or something of that sort. So when do you think that it is the correct time to go and meet the doctor, or when do you think it's okay to do the home treatment?
Okay, so you brought up a very important point. Let me go to the red flags. We call it as a red flags. So these are some of the signs which you need to go to the doctor immediately. So we call that as a red flags. Let me go to that slide. Yeah. So here in this slide, you could see if the pain is not improving with all the home remedies and with all your regular workouts, when the pain is not improving more than 6 weeks, getting worse and radiating more and more to the limb. So you need to consult with the doctor. Painful spine, even when you tap the spine, like for example, if you tap the back a little bit with your finger, and then it's causing a severe pain. So that is a sign of a fracture. So that's painful spine. And also fever and chills. So that means there is some infection going on in the body. So fever and chills. You are unable to move, like because of a spasm. Muscle spasms also cause very severe pain that you will not be able to move. Inability to move is a sign that you need to go to the doctor immediately. Weakness, if you are, see, your pain is there for a couple of days and it's radiating, and suddenly you're feeling like, I have difficulty gripping a glass of water. I have difficulty like holding an object in my hand, or I have difficulty lifting my arm up. That is a weakness. And heaviness, numbness and tingling with difficulty walking. So these are some of the signs which you need to go to the doctor. Headache, neck pain, sometimes when there is some issues in the nerve root in the upper neck region will cause some radiating pain to the head. So that could also cause some headache, but the headache is very severe, tearing kind of sensation, that you need to go to the doctor. When the pain is associated with dizziness, nausea and vomiting, you need to go to the doctor. And if you are using steroids for long term, whenever you have any pain, you need to check with the doctor because you have a past medical history, and that's why you are using the long term steroids. You are using the steroids for a long time. Family history of autoimmune diseases, like as I told, one condition called as ankylosing spondylitis. So if you have any autoimmune diseases running in your family, it's always a good thing to check with the doctor about this neck pain and back pain yearly. Unintentional weight loss. If you are losing more than 10 pounds of weight unintentionally in a period of 6 months time, that is something you need to check. If you are intentionally losing it, that's different. If it is unintentionally you losing your weight, you need to check with the doctor. And the last one is, if you have difficulty controlling your bladder or bowel movements, like you are voiding without your control, that is a sign you need to rush to the doctor. So these are some red flags which you need to go to the doctor.
Thank you, Dr. Karthik.
You're welcome.
We can probably take one more question or so. It's time to wrap up.
There's a question in the chat.
Yeah, are stand-up desks good for working long time?
So actually, that's a good question, because I would personally do not recommend one specific posture all the time. Don't stand for long, modify to sitting for some time. And then like if you are on a meeting, like I see people who are having the meeting, sometimes they are talking over the phone, you could walk and talk. So don't stay in one posture for long term. Like that's why, like even in the prevention strategies, one of the prevention strategy what I used is take a break. So that's very important. Like remember, take a break. Don't stay in the same posture all the time. So here it's called as a take a break. So that's very important. I do not recommend one specific posture more than at least like if you stay in that posture for 40 minutes, please go out or get out of the posture, change your posture, then do in sitting and then come back again to standing.
Great. Thank you. Thank you so much, Dr. Karthik. So do we have any other questions here? Okay.
Yeah, I have one question. So you spoke about
you are breaking up.
You're breaking up. Karthik, I guess. Sorry, Karthik, we are not able to hear you.
Karthik, you can type in the chat if you're not able to, if your voice connection is not good, you can type in the chat as well.
Am I audible?
Yeah.
Oh, sorry about that. No, I was asking, doctor was talking about posture. They advertise ergonomic chairs and mattresses with tilting bases, which can adjust to the body position. Are they really effective?
People with long-standing postural problems, yes, it is effective. And as I previously mentioned to one friend who asked the question about this, I would recommend, if you are going for a specific chair or a specific mattress, I would recommend to take a consult with either with your doctor, or if you have a therapist, you can have a consult with them with your problem. What is your problem? And then whether this particular chair or the mattress is good for you, because it needs a little bit one-on-one assessment, at least to know what exactly you are undergoing. And based on that, it is recommended, we will make sure that you would benefit from that chair or whether you will not benefit from the chair. But also, but if you think like, no, like I'm sitting all the time, I need to use a more comfortable chair, yes, go ahead, try it. That's absolutely fine. That's no wrong in that. Give a try on that, but make sure that if you have a chance, you consult specifically what is your problem, why you want to go for that chair, because people advertise a lot of things, but we need to make sure whether it'll be useful for me. The first and the foremost thing as a therapist, what I would recommend is, I want to use my muscles to be in a good tone and to have a good strength. That should be my first goal, to improve my posture, because the chair or the mattress won't correct your posture. It is just going to support you when you are using it. But when you are moving out of that place, you are going to depend on your muscles. So the first step should be correcting your posture with the use of your muscles, and with the use of the knowledge like what we discussed right now. I would recommend you to use that first, then have a consult with your doctor whether this particular device, like any equipment, or it may be a chair, or it may be a desk, or it may be a mattress, will be useful for me, and then go for that. That is my recommendation.
Thank you so very much for your time.
You're welcome.
So thank you, Dr. Karthik. On behalf of TCA, I would like to thank you for taking the time from your busy schedule and giving us so many valuable inputs and guidance. I also want to thank everybody who attended the session today. I hope you got as much as I got to know about so many things, and how much we can take care of our body and everything. So thank you everyone for attending. Thank you, Dr. Karthik.
Thank you, Sarayu, and I want to say thank you all who have asked questions and who have participated in this discussion. And thank you, Tamil Cultural Association of North Carolina. Thank you all.
Thank you, doctor. I think this was a
Thank
very
you,
excellent.
everyone. Thank you, Karthik. Thank you, Sarayu.
Thank you, Karthik.
Thank you all. We can end the session.